With the grace of Almighty and Honorable Founder President Dr. Ashok K. Chauhan Sir, respected Chancellor Dr. Atul K. Chauhan Sir, I welcome respected Dean Sir, Health and Allied Sciences, Professor Dr. B.C. Das Sir, Mentor of Amity Institute of Health Allied Sciences, Professor S.K. Srivastav Sir, and our respected Director Sir, IHAS, Professor Dr. Jasubanta Sethi Sir. I also welcome our esteemed guests, Dr. Ruchi Varshne Ma'am, Dr. Khayati Ma'am, and Dr. V.P. Gupta Sir. I also welcome to all my seniors, my colleagues, and my dear students. Clap for yourself as well. I would request all the dignitaries to please come on the stage. I am deeply honored to stand before you today as we gather to celebrate World Physiotherapy Day 2023. This day provides us with a unique opportunity to reflect on the invaluable contributions of physiotherapy to the health and well-being of individuals and communities around the world. Physiotherapy is a profession that touches the lives of countless people every day, offering hope, relief, and empowerment to those in need. It's a profession that recognizes the importance of movement and function in human life and strives to restore, improve, and maintain these aspects to the best of our abilities. The theme for this year's World Physiotherapy Day is arthritis. Arthritis is a collective term for over 100 different types of joint diseases affecting people of all ages, genders, and backgrounds. It is a condition that knows no boundaries, and its impact on individuals and communities is profound. Physiotherapy stands as a beacon of hope for individuals living with arthritis. The role of physiotherapists in the care and management of arthritis cannot be overstated. In the face of global health challenges and the ever-increasing burden of non-communicable diseases, the role of physiotherapists becomes even more critical. We are not just healers. We are educators, advocates, and partners in the journey towards better health. We understand the profound impact of physical activity and rehabilitation on both preventing and managing a wide variety of healthcare conditions. As we celebrate World Physiotherapy Day today, we must also acknowledge the resilience and dedication of our colleagues worldwide. In the past years, we have tested our profession in unprecedented ways. Many of us have been on the front lines providing care and support to patients during the COVID-19 pandemic. Our adaptability and commitment to patient care have been nothing short of remarkable. Looking forward, we must continue to advocate for the importance of physiotherapy in healthcare systems and ensure that our profession remains at the forefront of evidence-based practice. We should collaborate across disciplines, embrace technological advancements, and address health disparities to make quality physiotherapy services accessible to all. In conclusion, as we mark World Physiotherapy Day 2023, let us reaffirm our commitment to the mission of our profession to help move better, feel better, and live better. Together, we can make a meaningful difference in the health and well-being of the individuals worldwide. So I thank you all for your dedication in the field of physiotherapy, and I look forward to a day filled with insightful discussions, shared knowledge, and renewed inspiration as we celebrate the vital role of physiotherapy in promoting health and movement for all. So now I welcome all the dignitaries to please proceed for the lamp lighting ceremony to seek blessings from Goddess Saraswati.
या कुन्देन्दु तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्करप्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा ब्रह्मविचारसारपरमा आद्यां जगद्व्यापिनीं वीणापुस्तकधारिणीम् अभयदां जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थितां वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
Unfortunately, our Honorable Vice Chancellor Madam could not join us today due to her busy schedule, but she has sent all the best wishes to all of us on this special occasion. Now I welcome Professor Dr. Jasubanta Sethi Sir, Director at Amity Institute of Health and Allied Sciences, to kindly come on the dais and enlighten everyone with a welcoming speech.
A very good afternoon to all. The excited moment, excited day, excited week. The blessings from Almighty, as is said already, from Honorable Founder President, Honorable Chancellor and Honorable Vice Chancellor. We are here to observe, celebrate, remember, give our service to humankind, and do best in our profession. That's our motto. We have taken the oath and will be taking on 8th September, which is more practiced and remembered, the World Physiotherapy Day. The day has been extended. We don't observe only day, we observe week. It's not we, it's nationwide, worldwide. The contribution of the profession to our society, making so many camps, serving so many types of patients, reaching to corners of the society and giving our best. This profession was known not only from this post World War II, not from this Madam Macmillan, who is the pioneer and fast mother is known. No, the profession goes back to 422 BC, when three giants, in my word we say triple H, Herodicus, Herophilus, and Hector, before Hippocrates, already seen, already practiced as a teacher when no doctor word was there in the society, giving this physical therapy, physiotherapy, heliotherapy, water therapy, ice therapy, all this has been practiced. We remember today that as an elephant having small two eyes doesn't access to all parts of the body and doesn't estimate the size of his or her body. So we just go back to pre-Hippocrates day, that how physiotherapy is the mother of all other medicines. Not that medicine is the mother of physiotherapy. This gives us good example, instances, and all of you may be knowing that our physiotherapy, the profession, the Indian Association of Physiotherapy and the Council in India, the World Physiotherapy, World Conference of Physical Therapy in world, and moreover, the Health Professions Alliance, HPA, or World Health Professions Alliance, where the 5 professions recognized by ILO, and those 5 professions, they make the World Health Alliance, and we are fruitfully and happily, successfully in that. The doctors, dentist, physiotherapist, pharmacist, and the nurses. So again, this information is not the new, but we don't work only for this non-communicable diseases, what has been in rehabilitation area. No, we already stepped into the communication diseases. Recently, pandemic and post-pandemic, even now, we working hard, doing very deeply, whatever the symptoms led behind, and the long conditions, the nerve, these vascular conditions, the muscular conditions, what is coming post this infection of this COVID-19, and we are gaining it more and more. Of course, in scientific research and the contribution to our society to uplift our patients, save them from this dangerous outcome of this disease. So here, today's theme from this London, the headquarters of World Physiotherapy, that about arthritis including all. We just very much versed, all my students from second year onwards, they are very much versed in arthritis. Each and everybody are very much familiar, even studying in this these physiological aspects before studying medicine and orthopedics in 3rd and consecutive years. So this arthritis, how big problem, and how we stop from the degeneration, preventing it in cellular mechanism side, in our electrodiagnosis, electrotherapeutics, of course, supportive exercise therapy, and a few ergonomic advices and ergonomic managements. So next, other similar types of arthritis, the gouts, rheumatoid, all these things are we work upon, no doubt. And my students in MPT orthopedic branch, orthopedic specialty, they also article do, and they do also their studies, and a few of them already put paper in Scopus Index journals. So I am so happy once again about this information to mine this budding physios plus my postgraduates and doctoral scholars here. Again, as part of the protocol, I just formally welcome our Professor Dr. Bishidas who is the Dean of Faculty of Health and Allied Sciences and noted scientist, retired from ICPO and ICMR. And he has been very instrumental and keen behind this, our AIPT, and now it's the Department of Physiotherapy, of course, and I has the most other two departments to us. And he has been also instrumental that about this happening and the celebration of World Physiotherapy Week every year and going to villages and inaugurating this along with Professor Dr. Devseva Murthy. Even today also we discussed about how little difficult all this during this G20 session. So I wholeheartedly welcome you, sir, for this auspicious occasion, professional occasion, having scrutinized his busy schedule and came over here to attend this. Thank you so much from my side or from my student side. Next we have Dr. S.K. Srivastava is the mentor of our IHAS and is also retired the commissioner from the Rehabilitation Council, a member of Rehabilitation Council before he was the commissioner in the disability in UP. So he has been also very keen and instrumental for this and his support to this type of occasions to be celebrated and how best to be done for this. Even he is instrumental in giving us so many informations about this different types of projects coming under this health and family welfare as well as this social justice empowerment department, government of India. And he also very keen that how the department to be developed and the IAS will developed. So thank you so much for accepting our invitation, Dr. S.K. Srivastava ji, coming from this one. And then we have Dr. Ruchi Vasne. She is the treasurer of IAP, our Indian Association of Physiotherapy, the only national professional body. He is also national head of IAP Women Cell, and he is a very known person in IAP, and all of you might have seen her in many conferences, and recently also they had this conference IAP Women Cell in Delhi, and she is also very much keen and instrumental to this department since past 5-6 years, and she's been coming as examiner now here even many times. So we just take her points how to develop departments. Also she's been very instrumental and supportive during the inspection, being the member of the team of inspection. I have seen that she's young, energetic, and so instrumental to our development of the profession in our India as well as our department in Amity. So thank you, Dr. Ruchi, accepting our invitation, coming over here. Next we have Dr. Khyati, who is the Director, Pratyaksha Medical Care and Editor-Chief in International Journal of Convergence in Healthcare, ex-SRO AIMS, New Delhi. She is our alumnus in PhD. She has done a very good work and published in Springer Nature journal, and I'm very happy. And it was she who could get it. The small instrument from US, and she who has seen it, applied and seen it, where this anger goes down out of her study in the 12 parameters of heart rate variability. And of course, it was me in the brain child giving this type of study to her, the topic, and could do it. And she was the flying color after passing, coming out of the PhD, and conferred this last year. So thank you, Dr. Khyati, accepting our invitation to come over here. So with this, I welcome all my this budding physios, this undergraduate and postgraduate doctoral, the scholars to this, and hope this meeting plus this few presentations should be very helpful on this today's theme of arthritis in today's era. Thank you so much.
Thank you so much, sir, for sharing such empowering words with us. Now I request Dr. Pragya ma'am to please come on stage and felicitate Dr. Ruchi Varshne ma'am. Thank you so much, ma'am. Now I request Dr. Sanjeev Das sir to please come on stage and felicitate Dr. VP Gupta sir. Thank you so much, sir. Now I request Dr. Neha Gupta ma'am to please come on stage and felicitate Dr. Khyati ma'am. Thank you so much, ma'am. Now let us begin with the most awaited and knowledgeable sharing session by our esteemed guests. Our first speaker has a wealth of knowledge to share. Join me in welcoming to the stage Dr. Ruchi Varshne ma'am, who is a national head at IAP Women's Cell. She is one of a dynamic and instrumental personality in different activities for the upliftment of the profession. Please give a huge round of applause.
नमस्कार, गुड आफ्टरनून एवरीवन। सबने लंच कर लिया? So I think everybody is awake, alert. Yeah? Okay, so good afternoon everyone and respected dignitaries on the dais. Das sir, Honorable Srivastav sir, our very own Jaswanta Sethi sir. Yeah, you can give a big round of applause. Yes. VP Gupta sir, our senior, they are legends of the profession. Khyati ma'am, respected senior faculty sitting in the front rows, and a big round of applause to all the students who are here, listening to us, especially post lunch. You know, I can understand few may be sleeping. We all have gone through all these stages, है ना? और उसके बाद हमें program attend करना है. But you guys are bright, you are alert, you are awake. Thank you so much to listen to us. And okay, so we'll be basically सो वर्ड फिजियोथेरेपी वीक सेलिब्रेशन हो रहा है और आई हैव बीन पार्ट ऑफ I have been part of Word Physiotherapy celebration of MET since I think 2019. Seti sir has been always kind to call me kabhi offline or 2020 se I think in every program I am there online talking to you guys, but it's like very fortunate कि हम लोग आज आमने सामने हैं. We are there to discuss our experiences and to talk about word physiotherapy, to talk about Indian Association of Physiotherapists. As Seti sir said, that's the national association, and me being the treasurer of the association as well as the national head of Indian Association of Physiotherapists Women's Cell. And today I'm talking to the future leaders of tomorrow. So I just wish कि मैं जो भी कहूँ, I think you all go back with a takeaway message, with a passion to do whatever best you can do for the profession. आपके अंदर अगर कोई भी doubts है, कोई भी queries है, that what we are doing in such prime institute, you are meaning blessed to be here in MET. Or I think a big round of applause to all the management, the directors, VC ma'am, and everybody who's sitting here, who's giving time to the institute, and you all make, meaning you the proud MET students and the alumni who all are here, you make your institute proud, you make your profession proud. So word physiotherapy is a group of, do you know how many countries are there in word physiotherapy? Anybody who knows how many countries are there? It's a global community. It's like a big association, like we talk about Indian Association of Physiotherapists. Okay. So it's like a big association, which is a group of, anybody, how many countries? Koi guesses? 5050, anybody from here? Yeah? 15? 25? Anybody from the back side? Back side wale sone nahi chahiye, please, huh? How many? 100. So I think you are going near. So it is 128 countries in word physiotherapy. Okay. So such big. And it is like a group of 128 countries, and Indian Association of Physiotherapists is the we are the country and we are representing our country in that 128 groups. There are regions to word physiotherapy. So there are regions to word physiotherapy. And in India, on the similar lines, we have Indian Association of Physiotherapists, which is a group of 26 plus हैं, उसमें से कुछ डिस्ट्रिक्ट्स बाहर कंट्री से बड़ी हैं. जो मेंबर्स हैं, लड़ो मत भाई. तो जो बाहर मेंबर्स, हमारी जो डिस्ट्रिक्ट्स में मेंबर्स है, इंडिया सबसे ज्यादा, अब हम लोग पॉपुलेशन में नंबर 1 ही है, right? With this kind of population, with this kind of number, now with this World Physiotherapy Day, I think मैं सब लोगों को ये बताना चाहती हूँ, we should take a pledge that we will be number 1 in the world. Because we have such huge brains, you can't imagine, हमें लगता है कि बाहर हम लोग फॉरेन कंट्रीज में जाते हैं, डेफिनेटली बहुत सारे प्रिविलेजेस हैं, बहुत सारी चीजें वहां पे हैं जो भी इंडिया में हम लोग उतना डेवलप नहीं कर पाए हैं. बट देन कमिंग टू ब्रेन, आई ट्रूली बिलीव इंडिया हैज द बेस्ट ब्रेन इन द वर्ल्ड, बेस्ट ब्रेन. And with the kind of teachers, I have been listening, हम लोगों कई साल से, like I have been practicing for last 23 years. ठीक है. और हम लोगों ने जब पढ़ाई की थी तब उतना ये सब डेवलप नहीं था. अभी ओवर द इयर्स डेवलप हो गया और होता जा रहा है. एंड आई थिंक विद यू पीपल इन डूइंग मोर ऑफ रिसर्च वर्क, जो कि एमईटी बहुत प्रमोट करता है, with more of the evidence based practices, more of the documentation, I think you will take India ahead. You will take Indian Association of Physiotherapists ahead, and that is why I tell you that this college is the member college of IAP, and with this comes आप लोगों को स्टूडेंट मेंबरशिप, आईएपी की स्टूडेंट मेंबरशिप फ्री ऑफ कॉस्ट प्रोवाइड की जाएगी. So all the students from first year to internship are our student members. We will share a Google form with you. आप लोग अपने टीचर्स के हेल्प लेके उसको फिल करके वो डाटा दे सकते हैं. We will provide you the ID cards. You know how that will be beneficial. बेनिफिट ऐसा होगा कि यू विल बी अ पार्ट ऑफ द फैमिली. फैमिली मीन्स आप अपनी फिजियोथेरेपी फैमिली, जैसे हम बोलते हैं ना वर्ड फिजियोथेरेपी ग्लोबल कम्युनिटी, दिस इज इंडियन कम्युनिटी एंड यू शुड बी अ पार्ट ऑफ इट. यू शुड फील, रिकॉग्नाइज एंड रियलाइज योर रिस्पॉन्सिबिलिटी ऑल्सो. हमेशा एज अ स्टूडेंट ये मत सोचो कि हमें क्या दे रहा है, हमें इंस्टीट्यूट क्या दे रहा है, हमें टीचर्स क्या दे रहे हैं, हमारी एसोसिएशन हमें क्या दे रही है, क्यों हम इसका पार्ट बने, क्यों हम मेहनत करें. जो एक थोड़ी सी अप्रोच आने लगी है, आई थिंक यू शुड चेंज दैट अप्रोच एंड यू शुड स्टार्ट थिंकिंग हम इंस्टीट्यूट को क्या दे रहे हैं, हम टीचर्स को क्या दे रहे हैं, हम हमारी एसोसिएशन को क्या दे रहे हैं. सो दैट इज इंपॉर्टेंट रूल जो कि आज आप यहां से लेके जाओ. दैट इज गिव बैक. Give back to the community, give back to your faculty, give back to your parents, give back to your family, give back to each and everyone who has contributed to your growth. आज आप यहाँ हो, उसमें जो जो लोग जिम्मेदार हैं उन सब के प्रति, और सबसे इम्पोर्टेंट कम्युनिटी के प्रति, रूरल एरियाज, उन लोगों तक अवेयरनेस पहुंचाना कि फिजियोथेरेपी कितनी इंपॉर्टेंट है. Reaching out to nook and corner, every nook and corner of the country, it is your responsibility. Me being standing here, ये passion कहीं ना कहीं था. And when you start giving back to the community, when you start giving back to the profession, you become a leader. कोई और कोर्स नहीं होता है ट्रेजरर बनने के लिए या नेशनल हेड बनने के लिए. कोई कोर्स नहीं है. It is just your passion. It is just your love for the profession that will bring you here. And I wish this is the profession. अगर आप WCPT की साइट पे जाएंगे, वर्ड फिजियोथेरेपी की साइट पे जाएंगे, तो इंडिया हैज 72% women physiotherapists, girl physiotherapists. Do you know that? आप लोग जानते हैं? जोर से बोले, गर्ल्स तो जोर से बोले कम से कम. Do you know that? Okay, so 72% are girls in the profession. मैं सुनना चाहूंगी, how many girls are there? You can shout out louder. How many girls are here? And boys? तो शायद रेशियो एमईटी में थोड़ा डिफरेंट है as compared to the rest of the country, because I think it's 50-50 here. So, but that's great. We want more participation from both the genders. Otherwise, in India, it is 72% women, primarily. जैसे मैंने बताया, 600 के ऊपर डिस्ट्रिक्ट्स हैं इंडिया में, 35 राज्य हैं, यूनियन टेरिटरीज हैं. इंडिया बहुत ह्यूज है, बिलियंस ऑफ पॉपुलेशन. So we are such big in number. So girls के ऊपर इसके साथ बहुत ज्यादा responsibility आती है, that they need to be, very sincere, very dedicated. Especially वो stakeholders ज्यादा बड़ी हैं in the profession. So you need to be more responsible. That is a second takeaway message which I feel everybody should have. Everybody should remember this. Not to, मैं किसी भी मेल की कोई वो नहीं कर रही हूँ कि आप लोगों की responsibility नहीं है. इतने senior यहाँ पर लोग हैं, और with folded hands, I believe that all the males who have done so much good work, 1955 में IAP का जन्म हुआ था. And do you know word physiotherapy कब बनी थी? किसी को पता है? हम लोग सेलिब्रेट कर रहे हैं, थोड़ा सा बेसिक जनरल नॉलेज. जोर से 1996. हम 55 में थे, तो ठीक है, इंडिया सर बड़ा ही हो गया. नो, इट वाज इन 1951 जब वर्ड फिजियोथेरेपी बनी थी, और 1955 में IAP बनी थी. सो इट्स योर मदर एसोसिएशन, राइट? एंड यू ऑल are the part of that association, and you all should work to make your association stronger to represent. इस बार वर्ड फिजियोथेरेपी की कॉन्फ्रेंस दुबई में थी, and believe me, with the kind of paper presentation, scientific presentations जो इंडिया से गए थे, more than 100 participants were there. It's a big thing. हमें लगता है बाहर इतना ज्यादा कैसे मुश्किल होगा, कैसे जाएंगे, कैसे आना होगा. Meaning it's like people think that it's difficult to go out of the country, represent your country. It is not. It is like अभी आपको opportunity आपका institute देता है, आपकी association देती है, that you go on the international platform, represent your country, represent your institute, and represent your association. So with more than presentations, 100 presentations, even the word physiotherapy office bearers, they were shocked, they were surprised. Or on the stage of word physiotherapy, more than 25 principals were standing with Indian flag, and they were like so amazed that India is doing such kind of incredible work. क्योंकि अभी तक शायद हमारा काम properly बाहर पहुंचा नहीं है. Otherwise जिस तरीके की होड़ हम लोगों में लगी रहती है ना, हम लोग बाहर जाएं. I think वो दिन दूर नहीं है अगर आप सब लोग इसमें लग जाओगे कि बाहर से लोगों को वीजा लेके हमारे यहाँ आना पड़ेगा. To see what kind of labs we have, to see what kind of infrastructure we have, but definitely बहुत काम होना है. और अब हमारी काउंसिल एक्ट कर रही है, हमारी नेशनल कमीशन फॉर एलाइड एंड हेल्थ केयर काउंसिल, a bill has been passed. Now it is in the, basically it is in the process that registration and other things will be started. And आप लोगों की जनरल नॉलेज बढ़ाने के लिए मैं बताना चाहती हूँ, 23 मार्च को ये पास हुआ था बिल, ठीक है. और सर, आई थिंक IAP has announced that every 23rd March will be celebrated as Indian Physiotherapy Day. So next time we all will be celebrating इसी पैशन के साथ, इसी जुनून के साथ. आज के डेट में हर स्टेट के अंदर 30 से ज्यादा डिस्ट्रिक्ट सेलिब्रेट कर रही हैं वर्ल्ड फिजियोथेरेपी डे. There have been lot of activities, चाहे वो सिंपोजियम्स हैं, सेमिनार्स हैं, साइकिल रैलीज हैं, ब्लड डोनेशन कैंप्स हैं, कॉन्फ्रेंसेस हैं, कैंप्स हैं जो गांव में लोग लगा रहे हैं. बहुत सारे सरपंच लोग हमारे स्टेट चैप्टर्स और डिस्ट्रिक्ट चैप्टर्स को अप्रोच कर रहे हैं कि वर्ल्ड फिजियोथेरेपी डे पर वहां पे प्रोग्राम्स हो. लोगों को आर्थराइटिस, जो इस बार की थीम है, इन्फ्लेमेटरी आर्थराइटिस, इसके बारे में लोगों को और अवेयर करें, लोगों को लाइफस्टाइल डिसऑर्डर के बारे में अवेयर करें, और ना केवल बीमारी में होने के बाद हम लोगों को ठीक करें, बल्कि फिजियोथेरेपिस्ट का रोल है प्रिवेंशन में भी. अगर एक फिजियोथेरेपिस्ट को उसकी जगह मिल जाती है, उसको उतना स्टेटस मिलता है, आई थिंक वो बीमारियां होंगी ही नहीं जब आप ऑपरेटिव स्टेजेस पे जाओगे. यू कैन प्रिवेंट इट एट द अर्ली स्टेज, और अर्ली स्टेज मीन्स स्कूल. अभी भी आप देख लो कैसे कैसे यहाँ पे लोग बैठे हुए हैं, कितने लोग पोस्चरली राइट बैठे हैं, जरा बैठ के दिखा दो भाई. हाँ, अभी सब सीधे हो गए ना. So that is important. Every physiotherapist has to be aware about their own posture, because then only you will be able to treat this massive population. अभी भी आपको पता है almost 400 population के ऊपर भी एक फिजियोथेरेपिस्ट नहीं है. इतनी कमी है फिजियोथेरेपिस्ट की. तो जो लोग बोलते हैं ना कि फिजियोथेरेपिस्ट के लिए वैकेंसीज नहीं है, प्लीज डोंट थिंक अबाउट इट. इतने हजारों के नंबर पे एक फिजियोथेरेपिस्ट है, इतनी बिलियन पॉपुलेशन में. सो यू नीड टू बी जस्ट गुड इन योर वर्क, एकेडमिकली स्ट्रॉन्ग करो, अपने टीचर्स को रिस्पेक्ट करो, उनसे पढ़ो, वो लोग ज्ञान का भंडार है, उनसे जितना ले सकते हो ले लो. ये मत सोचो वो आपके पीछे भागे, आप उनके पीछे भागो. टीचर्स को सर्च करो, टीचर्स को उनके पास जितनी नॉलेज है वो लो, एंड यू विल गो एट द टॉप. देयर विल बी नो एंडिंग टू द गुड वर्क फॉर द फिजियोथेरेपी. सो आई थिंक अभी कोई बोर तो नहीं हुआ है, मैं इसको फिनिश करूं. सबको ठीक लग रहा है? सो आई थिंक यस. सो सराउंड योरसेल्फ विद गुड पीपल. Always believe that opportunities are there. You need to grab the good opportunities. Work for the profession. Love your profession. I always say that. And there will be lot of criticism, lot of obstacles in your life if you are doing a good work. ये ध्यान में रखना, जब आप अपने लिए ही काम कर रहे होते हो तो उतनी परेशानियां नहीं आती. जब आप समाज के लिए काम कर रहे होते हो, जब आप प्रोफेशन के लिए काम कर रहे होते हो, तो आपकी जिंदगी में, आपकी लाइफ में दुनिया भर की ऑब्स्टेकल्स आएंगी. There will be people who will be unhappy about your growth, unhappy about everything that you are doing. So don't worry about it. All the girls must listen. Don't get yourself demotivated. अगर आप कुछ गलत पढ़ लेते हो या गलत सुन लेते हो, और मैं जितना मोटिवेट कर रही हूँ, मैं पहले खुद डिमोटिवेट होती थी. So ऐसा नहीं है कि हम सीख नहीं सकते, हम लर्न नहीं कर सकते. And today I am here standing, and just to let you know, I am the only physiotherapist who is in the cover page of Swedish magazine. There is no other physiotherapist. And I haven't approached them. They have seen what kind of work, क्योंकि अभी भी वो लोग सोचते थे कि हमारे यहाँ women को दबाया जाता है, हमारे यहाँ women प्रताड़ित होती हैं, it is unsafe. But physiotherapy is not that way. Here the women are strong, intelligent, they know what to do. And that is why from Germany, the delegation has come and covered the work that IAPWC has done. And therefore, I am at the cover page of that magazine. I was the only physiotherapist who was invited by World Physiotherapy in International Congress. Only physiotherapist. हमारे अब तक क्या होता था? हम अप्लाई करते थे, हम पेपर भेजते थे, वो लोग रिजेक्ट करते हैं, हम पेपर भेजते हैं, वो रिजेक्ट करते हैं. जब प्रेजेंट होता है तो हम प्राउडली लिखते हैं, we are the presenters. Right? But जब उन्होंने invite किया, that means they have realized not the importance of Ruchi Vashne, but the importance of India. They have realized how important Indian brain is. They have realized how important Indian physiotherapy is and what kind of role you are going to play 4 years ahead. जब आप लोग pass out हो जाओगे. And I think आज यहाँ से इसी मैसेज को लेके जाओ, स्पेशली कि जब अनदर हम लोग 4-5 years के बाद हो सकता है सेठी सर मुझे नेक्स्ट टाइम बुलाएं या ना बुलाएं. तो जब भी मैं नेक्स्ट आऊंगी, I want you all to be, standing here and saying, yes, we made India proud. We made our country proud. We made our institute proud. We proud MATNs, and we have made our association proud. तो थोड़ा सा लाइट माहौल कर देते हैं, और मैं कुछ लाइंस हैं जो मुझे बहुत अच्छी लगती हैं, जो मेरी इस जर्नी में मुझे बहुत कुछ मोटिवेट करी. आई वुड लाइक टू शेयर विद यू. और किसी शायर ने लिखा है, मुझे नहीं पता उनका नाम, और मैं चाहती हूँ आप लोग ज्वाइन करें कि तू अपनी खूबियां ढूंढ, तू अपनी खूबियां ढूंढ, खामियां निकालने के लिए तो लोग हैं ना. अगर रखना है कदम तो आगे रख, पीछे खींचने के लिए तो लोग हैं ना. सपने देखने हैं तो ऊंचा देख, नीचा दिखाने के लिए तो प्यार करना है तो खुद से कर, नफरत करने के लिए तो लोग हैं ना. तू अपनी एक अलग पहचान बना, तू अपनी एक अलग पहचान बना. मीनिंग बी द बेस्ट वर्जन ऑफ योर सेल्फ. अंडरस्टैंड, अगर आप कुछ अलग कर रहे हो बाकियों से तो डेफिनेटली यू हैव अ बेटर ब्रेन देन अदर्स. तू अपनी एक अलग पहचान बना. भीड़ में चलने के लिए तो लोग हैं ना, और तू कुछ करके दिखा दुनिया को, तालियां बजाने के लिए तो लोग हैं ना. थैंक यू सो मच एवरीवन to patiently listen to me. Thank you.
Thank you so much, ma'am. Our director sir would like to speak few words. Sir, please come on the stage.
A very enchanting and exciting words and very informative. Now I have very special in the introduction. He is none other than the most respected Dr. V.P. Gupta ji, and especially he is the retired chief physiotherapist from AIMS, from cardiovascular surgery and rehabilitation department. He is the person has even this he has guided many MD and MS students during his professional time. So I wholeheartedly welcome V.P. Gupta ji for this auspicious function. So it is my best from my heart, from my core of the heart. Every time he used to be instrumental and he used to come and he has been in many of these boards of our Amit University, and even he has accepted our invitation and came here. बीपी गुप्ता जी नमस्कार and आपको सदर pranam and sadar naman. Thank you so much for this.
So now let's welcome our next guest of the evening, that is Dr. VP Gupta sir, member at Delhi Council for Physiotherapists and Occupational Therapists, and also a retired chief physiotherapist from AIIMS, New Delhi. Please give a huge round of applause for the sir.
Again, good afternoon, everyone. So, after the inspirational speech of Dr. Ruchi Varshney, like I see the image of our professional founders in her. And you know, we are still in infancy. When we talk about IAP or we talk about our profession in India, we are still in infancy in the sense that our regulation have just been started in 2021. As she said, the National Commission from Allied and Health Profession Bill has been enacted. And this enacted, I must correct her, I saw in the records, it was 28th of March. So, and 22nd May, the rules have been notified. So, 28th March will be the Indian Physiotherapy Day from now onwards. But what does it mean when we are regulated? Regulated in what terms? Can you correlate the theme of World Physiotherapy Day from our regulation? See, we are the second most populated country. The country which has most prevalence of disorders regarding the lifestyle disorders. And how these lifestyle disorders are being promulgated into disease, that is to be seen by none other than a physiotherapist. You know, we are the profession who can protect the society best from falling into the disease category. In 1994, there was a conference which I attended which was chaired by the president of International Council for Trauma Victims, for Rehabilitation of Trauma Victims. That was a conference organized by Medical Association, National Medical Association, Medical Council of India, and IMA, Indian Medical Association. And we 5 physiotherapists were invited. Our WCPT representatives were already there. Dr. Barbara Hetherington, she was the vice president of WCPT at that time. It was World Confederation for Physical Therapy, which has converted into World Physiotherapy now, 2 years back. So there they said that physiotherapy is the only profession which can heal the world. And physiotherapist is the only professional who have a healing touch in their hand. So it is not our privilege, but it is our duty. It is our responsibility and liability to serve the country and our fellow citizens and society for prevention of the disease. And arthritis is one of the most infectious disease. I would say it is infectious, not only inflammatory. The way it is prevailing in our society because of our lifestyle disorders, because of our style of our working, our official infrastructures, the advancement of technology which has led us to restriction in our daily movements, which has forced us to go to the gyms and training centers, which were never used to be. We never required the gyms and training centers in that matter, because Indian lifestyle was such an active lifestyle where we have to go on foot, go work in the fields, and we were the most effective population, most active populations in the world at one time. So we have to take a lesson, what Ruchi said, was very aptly mentioned that not only the treatment of the disease, everyone does a treatment in medical fraternity, but among all healthcare professionals, physiotherapy is the only one who can prevent the prevalence of the disease, the fall of the disease. And we must be proud of for that, for being a physiotherapy professional. Once the responsibility of the faculty to train the students in that manner that they are clinically more skilled and professionally more knowledgeable. So we would be getting our professional education in such a way that such kind of diseases which inflict upon our daily activities and our professional activities, which can be more economical also, because it affects the man hours, it affects our working capacity, our productivity. So what an arthritic situation give or reduce down the economy of our nation if we promulgate, if we calculate that much, it will be in the benefit of the society that only physiotherapists should work for prevention of such kind of diseases. The infective arthritis, the spondyloarthropathies, axial spondyloarthritis. So these kind of diseases or the disease patterns are prevalent only because of the modern lifestyle. This was not the case before. And physiotherapists, being the movement scientist, being the most skilled movement scientist with knowledge of pathology and pathomechanics and pharmacodynamics, we would be able to do it in much effective way than the other health professionals. So it not only empowers us, but it gives us the responsibility of taking the society out of the clutch of these diseases. So World Physiotherapy Day, or whatever we celebrate in future, the Indian Physiotherapy Day, that reminds us of our responsibilities. The celebrations are just to recommit ourselves for the service of the society. So I congratulate each one of you for the World Physiotherapy Day and hope on this day the activities organized by your esteemed institution, the chain of activities throughout the week, that will empower you, that will give you sufficient knowledge and chance to expose yourself for those activities which are professionally more important for you and will be coming for your benefit in your future career also. And these days are giving, as I said, it is a responsibility, day of responsibility. So with this commitment, and we, as Ruchi said, we must take the pledge to recommit ourselves to serve the society. Arthritis is not only the knee or back, it is all the joints which covers the disease, all the systemic diseases. It gives rise to a lot of disabilities, lot of economic loss, not only at the level of country, but at the level of each unit of our family. So we must rededicate ourselves on these days to get ourselves committed to get rid of these diseases, to take out our society from the clutches of these diseases. So I will not take much of the time with these words. I would again congratulate, I would thank the Amity institution, Dr. Sethi, Professor Das, Professor Srivastav, for inviting me to be the part of yourself. When we were the students, we used to celebrate in very small way, but these are the ways when the awareness comes out and we increase our knowledge in terms of the theme also and the related associated factors. So thank you very much again and God bless you. Thank you. Jai Hind.
Thank you so much, sir. Now I would like to invite our respected Dean Sir, Professor Dr. B.C. Das Sir, to enlighten all of us with his some powerful words.
Very good afternoon to one and all. First of all, I am sorry that in between I have to get into it because I have to have meeting scheduled back by back, so that I have to back to the office. So that's why I was little. So I have to come in between. So, so first of all, congratulations and all the best wishes for the World Physiotherapy Day. As Dr. Basne, she has told that you have now also Indian Physiotherapy Day. So many a times it happens that we have the World Physiotherapy Day or International any cancer day or some other day. There are so many days, and then you have your national days. So that's why it has been the National Physiotherapy Day. I think 23rd March, isn't it? I have written it rightly. So, but World Physiotherapy Day. So before I go, a few words just to tell you, but all the dignitaries on the dais and Professor Srivastava and our invited guests. Most importantly, that Dr. Ruchi Vasne, she is the Indian Association Physiotherapy Women's Cells head and national head. It's great. That's why she was looking for how many women or the girl students are in physiotherapy. The rightly question is asked. She has spoken many of the important aspects and very energetic to take this discipline of the medical profession to highest standard. And that's very important. You will be amazed to know that what she told is right. And it is, this information has percolated to you or not. That is a estimation or the assessment of the national assessment. I think international national assessment that those who are the lady medical professionals, they are the best doctors because they have a knowledge of how to do nursing, not only just treatment and management and all, but whole family, our all over the world rather, that the family runs with the basis of particularly in Indian and Southeast Asia, whole family norms that we have, that is depend on the ladies who are the main person to guide the whole family is taken care of by the ladies only. And that is why they have the nursing ability. They know where it is needed, what it is needed. They have a more sympathetic corner rather than just not a just straightway just a medical practitioner or a professional. You do something, but then ladies have some other corner, some other feelings, so they do better. They can understand things much better and they can strategize, have patience. So that's why. So it is good to know, and you should feel proud of it. So, and all the other guests that Dr. V.P. Gupta, and you have heard just now, and Dr. Ruchi Vasne, you have heard also. She was so energetic and all this, and then you will be listening to Dr. Khyati. So they are really from profession, and of course all the colleagues from this IHAS, or it is called IHAS, no? So this is a part of the health and allied sciences. So where it is physiotherapy, occupational therapy, as well as physiology. But you need to know how that connects. I would say, before I get into the congratulate you and blessings, but I would say that how that physiotherapy is come into existence. Because physiotherapy is mainly involved with the more of the anatomy, bones. You need to know more of the anatomy. Then only you will be a good physiotherapist. And then you have the muscles and neural network, the nerves. So these are the three major things to my understanding. I am not a physiotherapist, but a biologist and geologist, I understand that. So from that, point of view, original degree is that, so that I understand that what is anatomy and physiology. But here it is physiology, how much is involved, I do not know. You cannot equate physiology and physiotherapy. Everything is the system, physiology and other things, but then it is more of anatomy, muscles and neural network that you have to take care of. That's why there is an orthopedic specialty, neurology specialty and many other specialty and sports specialty are there in the physiotherapy. But nevertheless, you have a great job to do. Not much of medicine, but your experience, knowledge and your hand, how you are experienced to do the physiotherapy activity. But this day is that to appreciate these physiotherapy professionals. You are going to be a profession in that profession which takes care of the population from the childhood to the adult or adult to old age. Mostly in childhood and the adult old age, it is very important. Somehow after 50 or so, they will have the anything or the other, either lower back pain or the knee or ankle or anything or hand, so or spondylitis because of this the age of computer. Every second person, 99% have the spondylitis problem. That's why perhaps it is rightly pointed out after having so many years of, every year it is the 8th September is World Physiotherapy Day, and since 1996, and it was started because of the, and then to respect the Physiotherapy Foundation, it was in 1951. So this is being observed on that day, but it is 2 days before we are doing because of the closing of the G20 and all these aspects. So this is being held, but then it will be going for 2-3 days or 4 days more up to 11th, I think. So the question is that in the old days, this is a majority people suffer from after 50 sometimes or the other. They will have the lower back or a knee or on something. Mostly the problem is that is which I suffer also. That is why I am sharing it, that the L4 or L5, the mostly 90% of the people will suffer from this because of taking or walking or taking something heavy weight or bending down, doing something. So somehow at home or somewhere they will fall down, or somewhere they will get this. But then this is one type of medical profession where medicine is less applied, more is of the other way treatment, the exercise, physical exercise that you prescribe and you help the person to do who is the sufferer. That other person, the medicine or the surgery or the other things being done. So would you be a little attentive? If you are not attentive here, you are not attentive in your profession also. What is that? It is very emergency that you are doing it here. So we should not talk, we should not observe this physiotherapy day. It is no meaning to you. You have no respect for that. Tell me why physiotherapy is given the name, what I told just now. Why physiotherapy to be, it is announced that it is this discipline, physiotherapy. Why physiotherapy? What is physiology or physio thing is there? You are doing physio, but it's a physical exercise. Is there anything to do with physiology? What is the difference between physiology and physiotherapy? Go and read. If you don't know this thing, I know 90% will not know what is physiotherapy and what is physiology. You should know it. And you are students. You should be attentive. You should have the respect for your professor. Nevertheless, I wish you all the best for your profession. This is the day to respect the physiotherapists because the service they render to the whole community, the humanity, it is to respect you. And you should learn that. And you should earn that respect. from that, from your professor. When I had the L4, L5, the prolapse or the affected and the bulging, I cannot move. And what was walking or all these things. And I was advised that I should go, must go for operation after the MRI. But our honorable founder president, you have listened to him also, opportunity, maybe yesterday during the, anytime during this G20, S20. So he said, no, nothing doing. You should not go for operation. You should go for physiotherapy and other things. And I went for physiotherapy. And it's a neurophysiotherapy. And that's why I have developed the full faith in that. He also told me that, no, you should not go for any time because it is the patient's preference. He told, no, anytime you should not think of going for operations. So you should go for physiotherapy only. And I am confident after a month or 4 weeks, or if it is needed 5 weeks of sittings, you will be perfectly fine. And that would happen. And that is why I am standing before you. And I am walking since last 3 years. Prolific walking and all this, everything I am able to do. I could not stand for 3 months. And I did the physiotherapy, and all doctors said, all orthopedics, other surgeons, everybody suggested, you must go for the operations. But I didn't go. I did the physiotherapy, and he's a neuro specialist, physiotherapist, and he did me all right. I remember his name, Dr. Ankur. He must be somewhere else. I do not know. So that is what the faith. And since then, I advise everybody that you must go. Our register is telling same thing today during lunchtime. I told him, please go for a physiotherapy. You will be perfectly fine. And must go to a good physiotherapist and all. So you should have the professional perfections. And it is such profession that every corner you find this professional, they can have it doesn't need much establishment. You can open your own clinic, own things, and you can be biggest persons in this profession. So there are a lot of opportunity, but at the same time, I wish you, I will not take much time, wish you all the best and all the good thing on your profession. Be a good, this is your bread and butter. It is your profession, it is your life, you have taken this. So you should be second to none. That should be your motto. That is the thing, that I am a number one physiotherapist. So that should be your motto. Then only nobody can beat you. So this should be your motto, and you should take the place. And I think our previous speaker also told that you should take on this auspicious day the place that I should be the number one physiotherapist if it is my profession, and nobody can beat me. So this is what is the right spirit. And with that spirit, I would just bring to you the blessings of our Honorable Founder President, Dr. Ashok K. Chauhan, our Honorable most dynamic Chancellor, Dr. Atul Chauhan, and our Honorable Vice Chancellor. I was just before coming here, I was with her in her the cabin, and she is in the office. She is having cold and fever, and she must be leaving. I told her to accompany to come here. She told that no, I told I will not be able to come, and I am just now leaving home. But she told that, but she must be sitting there. She is mad of work. So, but she would leave early. So she is not keeping well. So that's why she was not able to speak good. So that's why she didn't come. So nevertheless, everybody's blessings are with you. And on my behalf and on behalf of all the faculty and my colleagues, wish you all the best. You are the real ambassador for us. If you do good, if you do your profession, you become very good in your profession, India or abroad, wherever you are there. So we have all the best wishes with you. And I am telling something I told little rudely. Please don't mind for that, but you should be a good person and good professional. And you respect your profession and try to understand the patient's problem. And you do the real contribution without medicine. Medicine may be simply painkiller and all these things are depending on the case, but you do the wonders. We cannot imagine that what wonders can happen just for exercise and your help. How did you do the exercise, help them to do it, and after some sittings and they become perfectly all right. Their movement, their fitness, without that, you cannot stand on the earth. So this is very important. Doing the movement and your all functions on the legs and hands and your necks and everything. And this year's the theme is arthritis, and already others have said arthritis means arthritis include all arthritis. So the spondal arthritis, and then the other arthritis, all types of arthritis are included in this, and particularly the spondal arthritis is very important because of the practice of this the computer. You cannot escape, and also your computer means is your Android phone. So this is, and the poster, I think poster, it was told just now, the Madam Speaker. So poster is very important, and a lot of people are doing research, but nevertheless, I being the chairman of the Research Council, University Research Council, those who will be doing PhD, they will know it, they know it. So this is whole universities Research Council. So there need for a lot of research in this field. You can come out with the new therapeutic measure, not that you have to always look for the US and Europe. You can develop something. So that is where your comes the innovative mind. So research mind and innovative mind is very important. So in here, in physiotherapy, you have an ample opportunity. The last 1 decade almost being associated with this as a dean and all. So what I have understood, there is a lot of opportunity in physiotherapy. There are a lot of standards can be developed, lot of approaches can be developed for the proper physiotherapy and management of the different cases. So with that, I thank you all once again and wish you all the best for your career, and be good, and thank you very much. Thank you, sir.
Thank you so much, sir. Now I would like to invite mentor of Amity Institute of Health Allied Sciences, Professor S.K. Srivastava sir, on the stage. On the desk.
Good afternoon, everyone. क्या हो गया? Good afternoon. So drowsy, huh? You might be in the sleep. Are you able to listen to me? Good afternoon. Great. So, my dear respected guests on the dais and friends of the dais, let me start my version with the statement of Professor Jasobanta Sethi. He told that physiotherapy is the mother of allopathic system. May I extend this statement? Probably physiotherapy is the mother of all treatment system, because without physiotherapy, cure is not possible in some cases. The required treatment that includes physiotherapy gets speed. But I have a different opinion. Mother means what? Mother means a sign of love, affection, your attachment, unconditional service. So, students, today on the day of physiotherapy, I was very happy to listen that now Physiotherapy Council has come into picture, that will refrain from the quacks in the society. I have headed one of the council in Government of India, that is RCI, when many of your groups approached me to make physiotherapy as part of the Rehabilitation Council of India. That time I tried also, but I could not. And now I'm very happy to listen that Physiotherapy Council is coming into existence, that will recognize you as a registered practitioner in the field, and the quacks will be out. Because in villages, there are many physiotherapists, qualified, unqualified, वो हड्डी जोड़ के बांस से बैठाने वाले हर 10 कदम पे मिलते हैं. They are also termed as physiotherapists in their desi language. But you as a physiotherapist, to my perception, that you are bound to touch the human body. You are supposed to touch anybody. And when you give your touch, it depends how soft and how lovingly you are touching your patient. Many times I have seen, I experienced that physiotherapists become a part of the family members. And it has the relationship for many, many years to come. So it is a profession when you develop your relationship with each one of the patients, many one of them at least. When you touch anybody, touch human body, half of the pain goes when you speak them softly and massage them softly. You can do something harshly also, but there is another way to treat them a little softly. Maybe his pain is treated in 6 days instead of treating in 2 days. No issue. But if you are soft, if you are sweet, if you are very caring, then half of the pain already goes automatically. So my humble suggestion with all of you, that being a profession like physiotherapy, you must develop your temperament as very soft. You might be meeting to the patients who is having pain, and anybody who is having pain may not be in a normal temperament. He may be in some anger, he may be some thoda jhallahat rehti na, so he may be of that nature. But you have to take care that you are not in the pain, you are a reliever of the pain, he is in the pain. So his absurd behavior, his anger is little bit tolerable. So develop your patience, develop your temperament to tolerate, to avoid the angry temperament of the patient, number one. Number two, when you touch any patient, touch it as if he is your family member. So when you have feeling that you are treating some of your family member, maybe your brother, sister, mother, anybody, then you will be having a different temperament, a different way of treatment. And friends, बच्चों, मेरा ये अनुभव है, I tell you very sincerely that if a doctor is sweet also, smiling also, then half of the disease goes automatically. Susmita Sen, when she was being questioned that what do you expect from a doctor, she immediately replied that a doctor must be very sweet and very attractive, very nice. So you are all the mother of all treatment techniques. You are carrying such a degree that will facilitate you to give treatment by touching a human being. So touch, first of all, touch the heart of the person, and then only you will be able to treat the physical body. If you are connected, you will become a part of the family for throughout your life. Money becomes secondary, and money is not at all an issue. After some time, you will realize that money is secondary. Right now, money may be primary for all of you, but at a stage you will find that money is secondary. And nowadays, this is very common fashion that when you are doing something which is very remarkable, you can also put it with the permission of the patient to put the treatment technique on the YouTube. Once it is popularized, any minor technique, once it is popularized, it will make you millionaire, billionaire. So there are many ways to earn money nowadays, but earn your reputation, earn your prestige, earn your name, fame is the only way that you treat the patient with softness, politeness, and as a very sweet doctor. So my good wishes, my blessings to all of you on this auspicious day of World Physiotherapy. 23rd March is again, we will be meeting on World, which day? Indian Physiotherapy Day. So I congratulate all of you to become a very good physiotherapist, and I make a call for all those who are pursuing bachelor degree to come pursue master's degree also, because this is the only time that you can pursue regular master degree, or else once you involve in earning from your profession, then it will not be possible. It will be very hard, very difficult to pursue the higher degrees. Pursue higher degrees right now at the moment if you can. Also go for some research work, go for some innovative work that is left, that is in your mind, some innovative ideas, thoughts that is endless in this field. Thank you all. My blessings to all of you. Thank you very much.
Thank you so much, sir. Now I welcome our next speaker, Dr. Khyati ma'am, Director at Pratyaksh Medical Care, Editor-in-Chief for International Journal of Convergence in Healthcare and ex-SRO at AIIMS, New Delhi. Please give a huge round of applause for the ma'am.
Good afternoon, everybody. मजा नहीं आया?
Yeah.
September होगी. Thank you. So good afternoon, everybody. First of all, I would like to thank all the dignitaries on the stage. Thank you, Jaswanta sir. Thank you, VP Gupta sir. Thank you, Ruji ma'am. Actually, it's my pride to share this stage. It's my honor because all my Gurujans are sitting with us. Thank you. And I would like to thank the faculty of MET. They are all my colleagues, my friends. Thank you for inviting me here. Today, as the theme of the World Physiotherapy Day is arthritis, so I would like to take a lecture on inflammatory arthritis. See, if we talk about the top 10 causes of disabilities, then arthritis and rheumatism is 8.6 million people per year are suffering because of arthritis. This is number one cause of disability.
Rest are back, spine problem, heart troubles, mental. But on the top, arthritis is there. This is about the classification. In the arthritis, these are basically classified in two types. It's inflammatory and non-inflammatory. Today I'm here to talk about the inflammatory arthritis, which is further subclassified into three groups, that is seropositive, seronegative, infectious, and crystal-induced. In seropositive category, it comes rheumatoid arthritis, lupus, scleroderma, vasculitis, and in seronegative, ankylosing spondylitis, psoriatic arthritis, reactive arthritis, and inflammatory bowel disease arthritis. This is the presentation. This is a differentiation in different types of arthritis, that is polyarthritis, inflammatory arthritis, and rheumatoid arthritis. In polyarthritis, the joint pain that affect 4 or more joints simultaneously. But in the inflammatory arthritis, it is caused from inflammation from an autoimmune response. Inflammatory arthritis is basically because of autoimmune response. And in rheumatoid arthritis, the specific autoimmune disease that typically involves many joints symmetrically. There is a symmetrical presentation of joint pain in rheumatoid arthritis. This is about the cycle of deformity and the activation of the process. There can be the two main stimulus to it. Either it could be the hereditary predisposition or it could be environmental trigger. Smoking is also one of the environmental trigger. Stress is one of the environmental trigger which can lead to the destruction of the bone through activation of CD4 plus T cells. And this process takes the three pathways which leads to the destruction of bone and the cartilage in this arthritis. It could be through endothelial activation or through macrophage activation or through B cell activation. If the endothelial activation is there, then it could lead to the recruitment of the inflammatory cells, which is leading to the destruction of the bone and the cartilage. Macrophage activation increases the number of chondrocytes, osteoblasts, osteoclasts. Further, it leads to the destruction of bone and cartilage. And B cell activation increases the rheumatoid factors, which further stimulate the immune complexes and lead to the destruction of bone in the cartilage. These are few TNF alpha. Have you heard of this TNF alpha cells? T cells, B cells, these are all autoimmune cells, which in autoimmune response act against our own immunity. And the normal joint gets inflamed and further the pannus formation is there due to the inflammation, angiogenesis in the synovial cavity, and leads to the destruction of the bone and cartilage. If you see this, you can see the picture of two hands. One is showing the normal hand, another one is showing the rheumatoid arthritis hand. So you can see different deformations which are there in the rheumatoid arthritis hand. There are peculiar specific deformities which occur in rheumatoid arthritis. Swan neck deformity, Bottineau deformity, ulnar deviation of the wrist. It is an autoimmune disorder which is more common in female as comparison to the males. It occurs in small joints, started from the small joints like PIP joint and MCP joints. Disability lead to disability. It is incurable and extra-articular complications may also be there because of the rheumatoid arthritis. Now, there are different tests. See, as just now I have said that the inflammatory arthritis is incurable, but how we can prevent it? The source is just to increase the awareness. And if we increase the awareness, the treatment can be done as early as possible. And if we start treating the patient in the early stage, then definitely we can prevent and we can improve the quality of life of a person who's suffering from inflammatory arthritis. So it is one S factor is there in which there are three S, that is stiffness, swelling and squeezing. Stiffness is the feature that is morning stiffness, more than 30 minutes. If the patient complain of morning stiffness more than 30 minutes, that could be one of the factor that is indicating towards that, yes, that person could have something of arthritis or inflammation in the joints. Swelling, if the persistent swelling is there in one or more joint, especially in hand joints, then you can see that. And if squeezing, if you shake hand and squeeze the hand of a person and that person complains of a pain, then definitely that 3S factors comes and you should suggest a person to take an appointment or an examination of a person for the arthritis. These are few pictures which are showing you the normal joint, early and established RA joints. In normal joint, you can see the capsule is absolutely healthy, synovial membrane is there, synoviocytes and the cartilage is in absolutely perfect position. But as the rheumatoid arthritis starts, our autoimmune cells like T cells, B cells, neutrophils starts coming in the joint cavity in the synovial fluid, and the inflammation process started. The synovial thickening start, the synovicytes and angiogenesis of the synovial membrane starts happening, which leads to the synovial thickening and further the inflammation of joint. If this inflammation persists for longer period of time, then the pannus formation is there, and the plasma cells start accumulating, which you can see in the established RA case in the third picture. And it start destroying the cartilage and the bony part of the joint. These are the joints which are commonly affected in RA, like cervical spine, shoulder, elbows, wrist, knees, ankles, metatarsobphalangeal joints, and in hand, it is PIP joint and metacarpophalangeal joint. These are the extra-articular manifestations of rheumatoid arthritis. Other than the articular feature, the patient may complain because it is an autoimmune disorder, so our immunity start acting on all our organs. Eye conditions could be there. Your oral health conditions, that periodontitis can be there. Then dry mouth. If the severe RA patient is there, then the mouth dryness is so much that that patient can't swallow even. Then the patient can complain of fatigue. There could be the lung scarring and the nodules can be found in the pulmonary area. There could be problem with the digestive tract. Heart diseases, as it is an inflammatory disease, so the myocardium inflammation can be there, and the patient in the severe stages can have congestive heart failure also. There are few skin conditions, then the inflammation in the joints. I have already discussed the articular part with you people, and the cartilage damage. This is the same I have discussed. Now, pathogenesis. There are route of infections. As you must have heard of injections. Doctors, orthopedician says that if you have pain, then we can give you corticosteroid injections, right? The moment the patient with the inflammatory arthritis takes these corticosteroid injections, the inflammation process increases and the degenerative process along with this increases. And I think it is like customized how the body of a patient is behaving. Some patient is going to feel relief for 1 month or 6 months, but later when the comeback is there of that acute attack of the inflammation, it is more severe. So these are few sources of infections in the inflammatory arthritis. The prosthesis itself is a source of infection. So what leads to the deformities in RA? Because of prolonged joint inflammation, the supporting joint ligament become loose. Because of that inflammatory stages, the tendon becomes malaligned. That they start D-shaping. Successive joints buckle, and the zigzag deformities. I just now told swan neck deformity, bottineau deformities. These are the zigzag deformities and the ulnar shifting of the fingers. Misaligned tendons pull the joint into the direction of increased deformity and aggravation of the joint deformity due to daily resistive hand use leads to the deforming forces and further bad shape. This is the clinical picture of a person having inflamed active RA. Can you see the PIP joints? That bulbous swelling is there. This is PIP swelling, in which the swelling is confined to the area of a joint capsule and synovial thickening like a firm sponge. And across the room diagnosis, prominent ulnar deviation. That's what I'm talking about, the zigzag deformities. The ulnar deviation of the fingers is there in this. Through splinting, we can, if we diagnose the person in the early stage, then we can definitely help in improving these, getting them their joints deformed through splinting. These are the few splints which we can use for their PIP joints, their wrist joints, their finger joints, and for their feet also. Now, there are distinct in different types of arthritis, like it could be monoarticular versus polyarticular. In monoarticular, it could be gout, infectious and reactive part, and in polyarticular, it could be RA and SLE. Joint distributions are PIPs and PCPs in RA and CLE, and DIP, that is distal interphalangeal joint, in osteoarthritis and psoriatic arthritis, and MTP, that is metatarsophalangeal joint, in gouts. Symmetrical versus asymmetrical. There is a pattern. In RA, there is a symmetrical pattern of arthritis in both the joints, both sides. So in symmetrical arthritis, RA and SLE is the categories which are there, and in asymmetrical, it is psoriatic and reactive arthritis which are there. This is one X-ray which is showing the early erosion of the ulnar styloid process. If you can see the arrow, this is ulnar styloid process. In the next picture, you can see the erosive changes in the ulnar styloid process. Ankylosing spondylitis is also one of the major problem which many people are facing, and if we diagnose them at early stage, then definitely we can help them. In this, the fusion, you must have heard of a bamboo spine. Bamboo spine is the fusion of the spinal vertebral column. They can't bend if they are in the later stage of this disease. In this, if the patient is in the later stage, the breathing start getting restricted because the inflamed costosternal joints are there. And the plantar fasciitis is one of the common feature in this. There are few again extra-articular features for the ankylosing spondylitis, like patient may complain of fever, like in the evening he start complaining that fatigue is there, pain in the jaw, then the pain in the rib cage. As I said, the costosternal inflammation is there. The chronic pain and stiffness in the lower back where your spine meets your pelvis. That is आपका जो SI joint है, sacroiliac joint. Uveitis, eye redness and inflammation. See, in ankylosing spondylitis, there is a triad syndrome. The patient may manifest with a triad syndrome in which the three things happen simultaneously: uveitis, urethritis, and आपका eye redness. So these are the triad syndrome which actually happen in the ankylosing spondylitis. Then in skin, patient might have psoriasis, alternating button pain, and the pain in your heel of the foot. This kind of a picture is there if the early diagnosis in 1947, 57, 67 and 72. Can you see the state of a person, how that person from the erect posture has become the completely like buckle shaped? Because that bamboo spine, the person can't bend. The complete restriction of the movement happens. These are few peripheral manifestations in AS. like 50% of the patient suffer from enthesitis, peripheral arthritis, up to 58% of the patient have peripheral arthritis. Then dactylitis is there. Much smaller number of the patients suffer from this. The first abnormality to appear in swollen joint associated with the spondyloarthropathies in enthesitis. So now the paradigm shift of the treatment, we can say, in the inflammatory arthritis can be the rationale of the treatment should be the large body of evidence which shows joint damage is an early phenomena of rheumatoid arthritis. Joint erosion occur in up to 93% of patients with less than 2 years of disease activity. It is so quick, it is so fast. Within 2 years, the joint destruction start happening. The rate of radiographic progression is greatest in first 2 years. Disability occurs, early 50% of the patient with RA will work with a disabled in 10 years. If the physiotherapy, if that person is not aware about the restrictions that person is facing, then within 10 years, the 50% activities are lost. Severe diseases associated with increased mortality. So this is one of the right criteria in which there are 5 clinical patterns. Asymmetrical mono or oligoarthritis is in 30%, ranging from 12 to 70% of the patient. Then there is symmetrical polyarthritis in 45%, ranging from 15 to 65% of patient. Distal DIP joint involvement, distal interpharyngeal joint involvement in 5% of patient. Axial spondylitis and sacroiliitis with HLA-B27 positive in 5% of patients, and arthritis mutilans in less than 5% patient. However, the pattern may change over a time and therefore not useful for classification. So, principles of our treatment should be, first of all, most important, early diagnosis, early initiation of the treatment, regular assessment, that disease activation score. There are GAL score. You must have heard of it, GAL score. That is gait, arm, leg, spine. This is the scoring which you can use for any kind of a musculoskeletal profile. And for ankylosing spondylitis, it is very good on all the axial spondyloarthropathies. Annual review is must for such patients. These are few drugs which orthopedicians and rheumatologists prescribe for this ankylosing spondylitis and rheumatic arthritis. So, how physiotherapy can help in this inflammatory arthritis? Physiotherapy plays a biggest role in this in preventing inflammatory arthritis. We personally are seeing many patients of RA and axial spondyloarthropathies, and they are really benefited by physiotherapies because all the treatments are customized. So earlier is physiotherapy start in such patients, we can improve the quality of life of any patient. You can tell them, you can give them home care programs, you can give them stretch-ins, you can guide them what to do, and splinting. So collaboration is multiplication. Let's work together to make this world happier place. Thank you so much. I would like to take 2 minutes more. This is an opportunity so that I can discuss the vision of physiotherapy, that physiotherapy is trending. You have got a huge scope in physiotherapy. Like Sir has just now introduced, that research is most important part, and in your course curriculum also 4.0 has been introduced. 5.0 has been introduced, and I don't know you are aware or not. Now the metaverse healthcare system is happening. Everything on the virtual mode, AI, ML, botpod, CNN, like central neural network. So Pratyaksh, my company is already working on the convergence of AI, ML CNN work in the prediction of sports injuries, in the prediction of neuroblastomas, in the prediction of diabetes. We are already working in the innovation, in developing the low cost effective tools in healthcare industry for precision. Under guidance of Sir, my physiotherapy PhD topic was on electroceuticals, which was deep brain stimulation. The seed of the thought was given by Sir only. Thank you, Sir. And this instrument of deep brain stimulation was sponsored to me by USA, the company of USA, free of cost for my research work. And now the company of USA we are in a process of collaborating with Pratyaksh. So near future, I think we will be the selling partners of that instrument in this, India also. And along with that, research projects and research, like it is growing like anything. And students, you have got such a benefit to have such a faculty, and under the guidance of Jaswanta sir, you can do wonders. You look at the lab, heart rate variability you have so many, it is well equipped. You can work on n number of things, you can do wonders. But it is just that you have to think about it. Thank you so much. Stay blessed. Thank you so much, ma'am. This was really informative. Please clap for ma'am once again. So to continue with our interactive session, please welcome Manas Kumar sir from BTL India to discuss on recent technological advancements in the field of physiotherapy. We welcome you, sir.
Hi, good afternoon, everyone. First and foremost, thank you very much. This actually happens to be an experience like a dream came true kind of a thing. The eminent doctors to whom I have been into the profession, seeing, observing, learning day in and day out, and immediately after the second day of Teachers' Day, I get the Guru Prasad. So getting an opportunity at this eminent hospital institution, in fact a teaching institution, to share that how technology can change the world. Well, I just being fortunate to be sitting just along with you, and there are doctors who have been sharing many good things about the technological advancement. And there were 2-3 challenges which were coming on to me. First and foremost, everybody was trying to give you a glimpse that how lucrative the physiotherapy is, what are the future perspectives, and how best we can perform in this. The last session was more of a science from the ma'am side, and that has also given us many good avenues to understand how has been the growth and what could be the projection side. Coming basically from the sales background, I would just like to share some figures with just from the inspiration of this meeting only I got it. So nothing there on the presentation, just got something on the cell. You know, by what rate in India the physiotherapy market is growing? Usually we have to think like that whether we are actually in the right proposition. Because when I was there a student just like you, immediately after completing my 10+2, it was expected to me that I should opt a branch. With this time in hand, I should be able to foresee what this degree will going to fetch me, not only academically, but also for a career, 4 years, 7 years down the line. So with this, just like to share a couple of figures to you. The current growth rate or the market value of Indian physiotherapy market is 0.96 billion. So that's one thing. And secondly, any idea, any vague guesses about what is the CAGR, compounded annual growth rate of this physiotherapy market? Anything? I think that with this digital India, people are more into spending as well as the saving. So everybody is looking forward for the rate of interest or maybe the investment at which their money is getting doubled. Why not the physiotherapy market in which we are understanding the rate? So to the ladies and gentlemen and the teachers, this particular market is growing at a rate of close to 9% CAGR. And it is expected that from 0.96 billion in 2022, by 2030, this particular Indian physiotherapy market will be of 1.9 billions. So that's something which gave us a confidence that yes, we are into a right direction. Now, once the scale is there and the business opportunity is there, we cannot abide the technological advancement into it. So taking an opportunity with much ado, would like to share that how at BTL we are committed to offer you the research oriented, well studied, well researched, durable physiotherapy equipments to make your dream into reality or your goal into a bigger infrastructure. And every time the patient care should come with precision and predictability. So this is how the 30 odd years of innovation, what our organization BTL, to whom I am presenting, is been all across. From 1993 till 2022, the latest data is available. And every year in or two, we have been fortunate to offer something unique, something reliable, something which has never ever happened before in the field of physiotherapy. And we continue the momentum in a way that in coming next 5 years, we will be having somewhere around 6 odd absolutely novel and new products in the field of physiotherapy and technological advancement with you. This happens to be my organization's global presence. More than 70 plus countries is what the global footprint of BTL India is. One more proud moment yet to come. We have been given an opportunity to take care of 2,800 employees and obviously their families who are associated with us. More than 400 engineers. Now the latest figures which I came is has crossed the 500. And 2 focus divisions. One is medical. In medical, we have got cardiovascular. From the physiotherapy side, the relevant one comes out to be CPET, that is cardiopulmonary exercise test. Whenever it comes with exercise, it's something relevant to do with physiotherapy. And the physiotherapy specialist. So these are the 3 verticals in which we are fairly available: physiotherapy, cardiology, and aesthetics. This is a glimpse of how our physiotherapy devices are available. All of them novelty, and all of them have got something unique, and bare average 5 patents exclusive to one device every time. This is about the cardiology part. With cardiology, we have got a capability to judge, assess, and prejudice that a person, an individual, whether it's fit for a particular sport or not. We have got a capability to understand and also to suggest an individual the consequences or the risk of sudden cardiac arrest. So these are the AI driven with 98% accuracy is what these devices have to offer. Now, not only the physical strength, but the outward appeal is also very requirement. So that's how PTL aesthetic plays a vital role. And a proud moment what we have amongst the globe, we have got 3 R&Ds, one at Czech Republic, one in India, the proud moment for all of us, and one in Bulgaria. So that's very Indian and heart, and it's the Indian brain who is helping the worldwide. This is a red dot design is something which is very prestigious to have. We are the one who got one amongst the very few physiotherapy devices, we have got the red dot design award in our kitty. These are how the production facility is available with us. Not only this, I hope these logos are very much common and easily identifiable. These are from the sports industry all across. They are the one who trust us because we are the one who gives predictable performance. And in every play, performance is the key master. These are the awards which has came to our kitty. I hope this have really given you some insights and the valuable one to believe that yes, we are into a right direction with a lot of technological advancement available. Now, would like to give you something more. A lot of me speaking, it's a time to show you and showcase some videos because technology is something which you not only read or study, it is also which you should experience. So with this philosophy, I'm just using the player so as to give you a glimpse of what the technology comes out to be. When technology comes into, it is but to happen that some technical glitches can also come across. This is one of them only. थोड़ा चला दो अभी तो थोड़ा चला दो मैं आपको फिर से कर दूं कहाँ पे है फोल्डर आप इनवाइट कर यही है here this is running a bit faulty ये है तो सारी एकदम सही चलने वाली नहीं चला बट इस वक्त सेटअप में नहीं आ पाएगा उसी दूसरी वीडियो में आ जाएगा हमारा तो क्या है लैपटॉप हाँ लैपटॉप क्यों नहीं
Dr. Anu, can you see that this side the students are making noise? Please let them observe. And faculty, I would request please see the senior student MPTs.
So, students, I request you to please pay attention to this. This is basically a situation where a patient is having stroke, and how, along with a good physiotherapy opinion, efforts, how devices can also be helpful in fighting against neuroplasticity and time and getting the patient back to normalcy. This is something gait training and gait improvisation which is being shared. This is something which is absolutely unique. These are known as end effectors. The three-dimensional sagittal plane is taking into action. This machine is capable enough to
Der Gemäß spielt dabei eine zentrale Rolle, weil über die Maschine schaffen wir jetzt eben die Schrittintensität zu erhöhen. Die Patienten üben in aller Regel 1000 und 1000 Schritte pro Therapieinhalt, eine Therapie kann ungefähr 30 Minuten. In der Zeit schaffen wir die 20 Minuten zu laufen. Und dann kommen wir eben noch über eine Physiotherapie und die Physiotherapie deswegen genau sehr gut so, dass wir Patienten eben dadurch im Alltag kommen und auch einige gerade bei der Tag von Anfang werden in Schule.
So this was our gate from BTL side, restoration of gate. Now giving you one more device, a technological know-how. Earlier, there is a therapy which is known as hydrotherapy, where we are using the buoyant force of water in order to weigh or make the person feel light, and then exercise can take place. This time, this particular technology 100% supports the body weight, and person gets an advantage of experiencing a moonwalking. It's an anti-gravity treadmill. So with motivational games, there is a sync between body as well as the mind. The patient themselves are going to understand that how the movements are happening and how the progression too. One thing unique about this technology, the last one, high intensity laser, apart from various credentials for this device, the best thing is this device is available in Amity, the same institute in which we are talking about.
It has got good result too.
Yes, thank you, Dr. Sir, for endorsing that. Thank you. More technologies which couldn't wait to give you a glimpse are as follows. There is one more. And believe me, whatever technologies and the new things I have been showing you, these are just less than half of what I am having in a store. No brainer in terms of understanding this language because we won't be able to. Now, we can see the technological advancement. Since being a global organization, we get an opportunity to get science and utility from different points of the world, different places of the world. This is one of them. This particular device is known as lymphostim device. This is basically very much required or useful in terms of onco rehab or wherever you feel that there is an issue with the lymph node. So there, this particular device works on a pneumatic compression technology and helps the patient to get relieved.
Excuse me, sir. I would like to ask. You are saying that this machine is for the onco rehab, right?
Also for the onco rehab.
Also for the. So
Yes.
it is like post-surgical cases you are treating, or what kind of data you have for this?
I'll be sharing that to you. No issues on that because there are various indications. On this place, I feel that maybe in the positivity of time.
No issue.
So I'll be sharing with you. No issues. We have got proper references and data. And this particular technology is very much used. Both it's available as well as in private setups. There is a concept well established and studies and researches are already there.
Okay, thanks.
I'll be sharing with you. No issues on that. So that's it. Thank you for giving me an opportunity to showcase how the technological advancement in the field of physiotherapy are, and with your support, how they can be much more. Thank you. Bye-bye.
Thank you so much, sir. Now I would like to hand over the mic to Dr. Anu Bansal ma'am for a panel discussion with our esteemed panelists, Professor Dr. Jasubanta Sethi sir, Dr. Neha Gupta ma'am, Dr. Sanjeev Das sir, and Dr. Pragya ma'am. And they all will be joined with our esteemed guests, Dr. VP Gupta sir and Dr. Khyati ma'am as well.
Good afternoon all. Good afternoon respected dignitaries on the dais, respected director sir. Thank you Dr. Rabab for giving me this opportunity to moderate this session as a panel discussion. I request our panelists, Dr. Pragya, Dr. Sanjeev and Dr. Neha to please come on the dais for panel discussion. So, as you all know, that the theme for WCPT this year is arthritis. Dr. Khyati has already so well, in such a nice manner, she has already explained about this inflammatory arthritis, which is the theme of World Confederation of Physical Therapists for this year 2023. So, as you all know, that we physiotherapists play a very significant role in managing inflammatory arthritis. So, to begin with our panel discussion, I first of all request our respected director, sir, Dr. Jasubanta Sethi, sir. Sir, would you please enlighten our students on the role of physiotherapists in managing inflammatory arthritis conditions? Sir.
Yeah, thank you, Dr. Anu. It has been well explained already by Dr. Khyati about this pathophysiology and pathomechanics. Little bit, I'll just add it here, where it is lifelong and can be prevented in very early stage, because the inflammatory factors, this TN alpha and all rest all biological parameters to be checked and to be treated by a rheumatologist in early phase along with an orthopedic physiotherapist. Here, the posture itself, how it is going wrong with the swelling of the joints in early phase, that should be managed. How to reduce in this inflammation as well as the pain, the stiffness. Thus, these three major factors out of 5 of the inflammation on the cardinal signs. So, the movement and the rest with this lively splint, plus these active exercises without splint in daytime, before going to sleep, even 3 times a day or 4 times a day as per the advice of the physiotherapist, plus taking a pre and post data, how the alleviation of the pain, swelling, tenderness and overall inflammations, along with this every 3 months the biological parameters, how it is coming down in the blood checking. So this is from my side in the parallel list. Thank you, Dr. Anu.
Thank you, sir. May I request Khyati ma'am, could you please enlighten students regarding some new advancements which we follow as a physiotherapist in managing these cases with inflammatory arthritis?
Yes, ma'am, definitely. As I was talking about the role of AI and machine learning, we can, if the prediction of the disease comes earlier, and AI can definitely play an important role in that, then we can help the patient to get the recovery and to improve the quality of life. That deformities will not happen if the disease will be predicted earlier. Thank you, ma'am.
Thank you so much, ma'am. Yes, very important point we noted here that as ma'am very correctly mentioned that if we are able to predict the occurrence of any condition, then definitely we are in a better state to manage it. Now, may I request Dr. Sanjeev to please highlight what are the new diagnostic criteria if we talk about rheumatoid arthritis?
Yeah, so according to the American Rheumatism Association, they have developed new diagnostic criteria. In the new diagnostic criteria, they are having 7 categories. The first one is having morning stiffness greater than 1 hour, then arthritis of 3 or more joint areas, arthritis of hand joints, symmetrical arthritis. So these particular 4 diagnostic criteria which I just mentioned, they should be at least having a duration of 6 weeks or more. Other than this, there should be like rheumatoid nodules, which we particularly see at the olecranon or might be the TA. Then rheumatoid factor, and in particular the radiological changes. Radiological changes means erosions and periarticular osteopenias. So out of this 7, at least 4 or more should be present to confirm that it is a rheumatoid arthritis. And definitely investigations are there with radiological investigations, blood investigations, synovial fluid arthroscopy or examinations. So these are also available. Thank you.
Thank you, sir. So, dear students, please note, as just now sir has mentioned about the cardinal features, or I would say some characteristics, some specific diagnostic criteria which a patient must meet, then only you would say that, okay, this patient is suffering from rheumatoid arthritis. So please note, as per the recent guidelines, the 4 criteria which a patient must meet. Now, may I request VP Gupta sir, sir, would you like to throw some light on how these assistive devices can help in managing these patients with inflammatory arthritic conditions?
See, managing arthritis is not an easy thing. It's a challenging job. How after the fall of arthritis, as Dr. Khyati said, first of all, after prediction of arthritis, we have to manage about the need of the patient regarding the functions, the ideals, the occupational compulsions, and the other needs, the household and occupational needs. And for that, whatever assistive device is required, so that there is no fatigue, there is no degenerative escalation. All these things will be managed only when a proper environment is given to the patient. So the kind of exercises, the assistive exercises or the assistive active exercises, the assistive devices in terms of maintaining the joint in a position, in a functional position and in a non-fatigable position during the work, during rest, and especially during the sleep. That is a challenge. So assistive devices in terms of their functional or their resting space, both are important. And that I think innovatively we must learn and devise such things which can be very easy to be applicable and which can be easy to be available to every patient, even in household, general household like the villages. Our primary healthcare centers should be equipped with such devices. Thank you.
Yes, sir. Yes, sir. Very correctly said. As in our Indian population, everybody is not so economically sound to afford very high-tech devices and assistive aids. So definitely we have to come forward with more such new inventions, innovations, and such assistive devices which a common person, a common man can afford. Yes, very rightly as sir has mentioned. So probably you students, it's further, I would say, a task for you also, as you are working on the various research projects. You should think over how we can further work upon bringing up, inventing, coming up with new innovations and coming up with new such assistive devices which are available, which are made available for our Indian population at very low cost. That is one of the major factors. May I request Dr. Neha, ma'am, can you please elaborate what is the relationship of stroke with inflammatory arthropathies?
Thank you, Dr. Anu, for this unique question. Now, before I start with this role of what challenges a stroke patient will face, I would like to highlight here, since we are talking about rheumatoid arthritis, inflammatory arthropathies, that inflammatory arthropathies are posing as a risk factor for stroke. So there have been studies which are highlighting that as the C-reactive protein and as inflammatory markers like interleukins are increasing, so they are giving it's a more risk for stroke to happen. So now a stroke patient and diagnosis of rheumatoid arthritis combined is posing obviously a lot of challenges for a physiotherapist. Like the conventional therapy will include managing the strength, but since for stroke there is hemiparesis, you will have to think about newer ways, newer techniques, that how we can manage the pain of the patient which is due to arthritis, at the same time how we can give him exercises to strengthen. When we talk about range of motion, maintaining mobility, at the same time we will have to manage the tone of the patient. So if there is hypertonicity, there is spasticity, and then giving him stretching exercises, so that this is going to be a unique combination. Arthritis requires a lot of, stroke requires a lot of weight bearing exercises. So we are teaching our patients to take weight on the joints, but that will be a problem with patients with arthritis. So again, we will have to develop different exercises to suit our patients. So all in all, we will have to think about a lot of multidisciplinary approach, and we will have to think about newer ways how we can combine and how we can make it more beneficial to the patients. Thank you.
Thank you, ma'am, for so wonderfully enlightening. When you come across a patient with stroke and simultaneously with these arthritic conditions, so definitely it's a big challenge to manage both the things. So ma'am has very nicely pointed out certain points, how we can work, how we can think of more innovative ways, new exercises, how we can bring about modifications in our exercise protocol so that we can effectively manage both the things. Now, Dr. Pragya, she has joined us. May I request you, ma'am? So can you please elaborate how will the role or what will be the role of physiotherapists, especially during the flare-up stage of rheumatoid arthritis?
So thank you, Dr. Anu. So flaring of the joints, like flaring is where the inflammation, pain, and swelling is there around the joint. So it is a very common occurrence in the patients with rheumatoid arthritis and even the inflammatory arthritis and other forms of arthritis also. Now, what happens is when there is a flaring of the joints, usually the patients think that now because of pain, I won't be doing any activity. I will be doing the rest. So no activity, only medications will be given. But as you know, as Dr. Khyati has also told in her presentation, like arthritis is the highest problem. Along with that, there is a cardiovascular problems associated, which is the second highest leading cause of disability. So now what happens when the person becomes sedentary because of the flaring of the joints or because of the symmetrical involvement of the joints? So their cardiovascular fitness gets affected. So flaring doesn't mean that the patient has to be prescribed full rest or he has to be advised to be on bed or do not do any physical activity. So as a physiotherapist, so we can guide them to modify their activities, which will not put stress over the involved areas or the involved joints. So as a physiotherapist, so our guidance to or our education to the patients should be that we have to modify the activities which won't be decreasing, which won't be putting load over the joints. And second most, we will be telling them certain light exercises which overall helps to improve their cardiovascular fitness. And very importantly, never not only focus on the joint exercise of the muscles around the joint, also focus on their overall cardiovascular fitness in patients with arthritis. So where any form of arthritis, you should focus on their overall physical activity, like indulge them in some simple cardiovascular activities like walking, or if not able to walk, cycling also without resistance, or upper body ergometers. So like such activities which do not put much stress over their joints and does help to improve their overall blood flow and the muscle activity. So thank you.
Thank you, ma'am. So just now, my next question, I request Dr. Jasoban Sethi sir. Sir, just now as Dr. Neha and Dr. Pragya mentioned that we need to bring about certain modifications in their exercise regime so that they are not to be too strenuous also, such that a patient gets fatigued. And simultaneously, we want a person to be exercising also. So, sir, in your opinion, is there any role of lifestyle modification also in managing these patients with inflammatory arthritic conditions?
Yes. This arthritis, the tendinoarthropathies, either it's in a tendon myo level or it's a cartilaginous level. So both the things needs a rest, and it is as weight bearing or non-weight bearing joints, or heavily action oriented or moderate action oriented or low action oriented joints. Accordingly, we have to see. So followed by the rest, the treatment regimes, as I already said, that the local electrotherapeutics with these devices, resting devices, then the exercise therapy with the FITT role, FITT formula to be advised, depending on how the pre and post analysis of, that means this outcome, either the prognosis is good or not. So the lifestyle is another one where this may be having on this loaded or the semi-loaded or highly loaded joints, or non-loaded, that means this the hand joints or others. So here we have to see, suppose the hand joint, this what are the tasks, accordingly the activities should be modified and ergonomically they should be checked. And here is the ergonomic take-home advice is, what are the parts of the this joints is involved, those parts should be given lesser stress in activities than other parts. Then we'll have a time to heal, even though in non-rest times. Thank you.
Thank you, sir. So, sir has mentioned very important point regarding the ergonomic advice. The students, please do take a note of this, as sir has so nicely explained that in managing these patients along with lifestyle modification, ergonomic advice is a key. Now, may I request Kathy ma'am? Ma'am, can you please say what are the barriers that we face while prescribing some protocol to these patients with inflammatory arthritis?
Thank you, ma'am, for asking this question. Ma'am, first of all, inflammatory pain itself is the biggest barrier to do any kind of activity. And above all, the therapeutic alliance can play most important role in treating such patients of inflammatory arthritis, because psychologically these patients are so down that they need that counseling, that this is not the end, the improved quality is still ahead, but definitely you have to support the therapist. So I think the therapist should definitely work on the therapeutic alliance. Along with that, the pain management is the prime most barrier, which has to be treated through our electrotherapy instruments or electroceutical devices. Above all, yes, on this I can say that that deep brain stimulation, yes sir, Jaswanta sir, alternating current stimulation can also help. Why? Because that anxiety, depression and insomnia, these are the most prevalent problems which are faced by the patients of inflammatory arthritis. And if we work on the deep brain stimulation part, then definitely we can do wonders in inflammatory arthritis as well. I think the whole important things are still to explore in this field. Thank you.
Thank you, ma'am. So yes, ma'am has brought this very important point into picture, that it is not only the physical aspect that we as a physical therapist have to manage with in these patients with inflammatory arthritis. Psychological aspect is another important thing that we have to look into, that we have to work into. So here, you as a physiotherapist are not only there for treating the physical aspect, you also have to work as a counselor. You have to work as a psychologist. You have to understand the psychology of your patient and then manage it. May I request EP Gupta sir? Sir, can you please say that what will be the prognosis of these patients like with ankylosing spondylitis?
That's a very important question.
Yes.
Because in India, like, we are the productive country right now. And we cannot afford to take our economy to that level that most of our working hands are down with the disease or they are unable to perform. So early detection, as Dr. Khyati had already explained in her presentation, that early detection, early screening and timely screening is the most important factor for these patients, these kind of patients, to determine that what treatment, therapeutical devices or therapeutic advices they require, and prognostically the follow-ups, regular follow-ups of these kind of disease, these kind of patients, because these are the degenerative diseases. So any inflammation or any environmental factor or any physiological factor like smoking or nutritional allergies, they can infuriate such kind of situations. So these patients have to be strengthened at the time when the pain is less. So our therapeutic compliance with the time should be such that the patient is most compliant at that time, so that the productivity of our exercise regime is most effective. And secondly, the follow-up and the screening, both prevention and prediction of prognosis is most important part in such cases. So regular follow-up, and to make it understand to the patient that they have to visit their physiotherapist regularly or to their family physician regularly with the problems of pain is the primary problem. Pain in activity or rest is the secondary problem. And associated symptoms like, as she said, the depression, insomnia, anxiety, and the tendencies which the patients get after the disease. You must have heard a lot of cases are happening in such kind of diseases, because the patient feels frustrated that they are not productive to their family. So counseling as well as the physiological factors, both have to be cumulatively work for such patients. So prognostically, if we manage the patient with regular follow-up, with proper devices, with proper advice, nutrition, and their energy conservative techniques, I think prognosis must be good. We have seen the patients, because we see in cardiac surgery for last 36 years, I am seeing patients for rheumatic heart diseases. Most of the patients have active rheumatism in the joints also. But we can manage those patients successfully and we can mobilize them as per the routine, as per our schedule, like the other patients we do in. So that is the success of physiotherapeutic interventions. Thank you.
Thank you, sir. So here, one important takeaway message, as sir said, that if a patient is regularly following up, if it is being predicted at a very initial stage, that okay, this person may develop. So all these factors can effectively bring a good prognosis even in management of these cases. Now, my next question, may I request Dr. Pragya to please elaborate on the role of physiotherapy in managing cases with juvenile idiopathic arthritis.
Yes, Dr. Anu. So this is juvenile idiopathic arthritis. As you know, that rheumatoid arthritis, osteoarthritis, it is a common arthritic condition in adults, and juvenile arthritis is a problem in children. So when this arthritis happens in the joint in the children, so that is also a very problematic for the children, because children, as you know, they are very active. They want to roam around. They don't want to sit at one place. So again, as a physiotherapist, we have a very important role in management of juvenile arthritis. So again, how we are going to help them? In the acute phase, the treatment will remain the support to the joint and electrotherapy modalities along with medications. But we have to take care that the uninvolved joints can be used to promote their overall fitness or their ability to do the work. So activity modification will remain number one thing. So we have to modify the activities. We have to tell them that what activities can increase the load over the joints and how we could modify the activities. Suitable ergonomic setups can also be designed or given to them, and then we can also tell them certain exercises which will help to strengthen the joint, and they can lead a normal life. There is not a problem that they won't be able to perform their other activities also, or they don't be able to participate in their various activities. So they can lead the normal life, but they have to do certain activities, certain modifications, and certain help of supportive devices which will help them to lead a very normal life. Okay, so as a physiotherapist, definitely we can help the patients with juvenile arthritis also.
Thank you, ma'am. My next question to Dr. Sanjeev. Sir, can you please say what ergonomic advice can we give regarding the positioning of these rheumatoid arthritis patients?
I'm pleased to hear this question actually. We have been speaking about medical treatment, non-operative, operative management, but pertaining to ergonomic aspects, if we see the first and foremost, I will talk about that it's related with good arthritic body mechanics. So first and foremost, if I talk about rheumatoid arthritis, then these patients get fatigue early. And therefore, this patient should not apply more force than they are comfortable. And definitely nowadays ergonomic design gadgets, tools all are available, ergonomic chairs available. So one should be using these designed tools to avoid stress and strains in the joints. When we're talking about good arthritic body mechanics, particularly we have to be mindful about the wrist joint. The wrist joint has to be like in neutral so that the forearm and the hands are in line. If particularly the patient is doing a desk job, then the neck should be in neutral, head should be in line. And if you're talking about the hip joint, then it should be comparatively little higher than the knee joints. And the foot, it should be extended a little forward so that the pelvis is also balanced. Mostly we have seen the chairs, and the students are sitting in the chairs. You can find the forward, the tilt is where the knee is lifted up compared to the hip. And I'm talking about the opposite. If we talk about the sleeping positions also, it requires ease of the joints. Otherwise, the conditions might get worse. So in such cases, the head, neck, spine, it should be in line. and the head should not be excessively tilted, okay, on one side or forward or backward with a pillow. So patient should be lying on the back rather than on the tummy. So I suppose these are the most preferable positions patient with arthritic should have. Thank you.
Thank you, sir, for providing these some important points regarding the ergonomic advice. My last question, I would request Dr. Neha, what, as a neurophysiotherapist, what challenges, ma'am, do we face while dealing with these patients with not only stroke but with inflammatory arthropathies?
Again, thank
How
you,
can
Dr.
we
Anu.
manage?
So I think the biggest challenge, as we also heard, is pain. So the problems which our patients are having of paralysis and weakness, but then along with that, when there is pain, so then the paradigm shift is towards pain management. So because of that, the rehabilitation is kind of longer. So patients feel that, they are being held back. Like we all know that the initial few months are very, very important. Like if we talk about stroke management, and in those initial months, if the pain because of the inflammatory arthropathies or arthritis is pulling them back, then the rehabilitation is delayed. So because of that, unnecessarily the patient loses that crucial months whereby we should work, and whereby we can say that neural plasticity will be the most active. Thank you.
Thank you, ma'am. So, well, dear students, you had a chance to get the expert opinions, expert advices from some of the reputed professionals in physiotherapy arena. So I hope all of you must have gathered today a lot of information regarding inflammatory arthritis, and you could understand that we have a long way to go. If we work upon actually towards the benefit of these patients, there is still a lot more we physiotherapists can do. Although yes, we play definitely as one of the important healthcare professionals. We have a very important role in managing these patients with inflammatory arthritis. So with this, I thank all the respected panelists here for being here and sharing their opinion. Thank you. May I hand over to Dr. Rabab?
Thank you, Anupam, and thank you to all our panelists. Now I would like to invite Dr. Sanjeev Das sir for vote of thanks to our panelists, esteemed guests, and our students.
Thank you, Dr. Rava. Today on this special occasion, I would like to seize this opportunity to thanks our Dean of Health and Allied Sciences foremost, Dr. B.C. Das, Professor S.K. Srivastav, who is the mentor of IHAS, for sharing their esteemed insights with us all. I would also like to extend my warm gratitude to Dr. Ruchi Varshanik, Dr. V.P. Gupta, Dr. Khyati, for their benevolent discourse to us and our students. Particularly a big thanks to all the panel members present here, our respected Director Sir, Professor Jagvendra Sethi Sir, Dr. Neha Gupta, and Dr. Pragya for gracing the stage, illuminating their views, and enlightening us. We are immensely humbled by the efforts of all the faculties of IHAS. And finally, I would like to thank to all the students sitting here because of particularly the patients as an audience. I'm sure that each of you have gained something today and possibly will be taking back to the home and will be getting benefited. I'd like to end with with a beautiful quote from the philosopher Socrates. The only true wisdom is in knowing that you know nothing. So that means keep on learning and keep on knowing. So thank you once again to all of you.
Thank you so much, sir. Now I would request all the dignitaries to please proceed forward for high tea. And thank you to all the students and wish you all a very happy World Physiotherapy Day.